At this time, I would like to introduce Amanda Mulcahy, who is an occupational health nurse from Swampscott Public Schools in Swampscott, Massachusetts. As an occupational health nurse, she oversees the school district's health and safety, including the nursing departments. In collaboration with her superintendent, she has developed and implemented strategies to control and mitigate the effects of COVID-19 in schools. And although I have not heard her presentation, I bet there are more rigorous recommendations than what are currently being proposed in the Kentucky House, which just advanced a bill banning all public school mandates regarding masking. So at this time, I'd like to turn the presentation over to Amanda.
Hi, everybody. Thank you very much. Thank you for that lovely introduction. So I'm Amanda Mulcahy. I'm the occupational health nurse, as Kevin mentioned, in Swampscott Public Schools. I started this role in September in 2020 when we were actually all remote in Massachusetts. And the big question was, how do we get our kids back to school, right? So that was the biggest task that I had to figure out back then in like the first couple of months of my position. And as of like mid-October, we were able to start rolling in students phased in, which was really, really nice. Nice to see their little faces back into school. And as a parent, that was my biggest thing, is like, how do I get my kid back to school, which kind of made me look into this position in the first place. So just a little background about Swampscott in general. We have about 2,100 students in 5 different schools. We have 3 elementaries, a middle school, and a high school. And I oversee the nursing department and about over 400 employees to run the 5 schools in the district. Our mission has been always with this pandemic is to keep the students and the staff safe with significant consideration to minimizing the disruption of learning for our students and their families. And honestly, our priority is just to be able to decrease the time that was lost on learning. I think that was our main goal. And the best way that we figured out was really kind of adapting to, if you guys are familiar with, I think it's Anne Mackey and James Reese's Swiss cheese respiratory defense mechanism, where you have multi-layered approaches to really fight back the pandemic. So today I was just kind of asked to talk about some of the stuff that we really rolled out here in the district that was really beneficial for us. So the main big things that we did was improve our air quality, masks mandates. We emphasized and promoted like the big things, which is like vaccination and boosters. We were really vigilant about monitoring for symptoms, data collection, and monitoring some of those trends, and really doing like robust testing. So I'll go into like a little bit of depth into each of them. So our district really put a lot of effort and some of our grant money into purchasing new air purifiers for all of our schools. We were very fortunate that we had that grant to help, which was a federal CDRF response grant. We spent over $38,000 in really improving the air quality in our district. Just about every classroom was able to have some sort of air purifying system in there. And we really tried to promote and educate our staff that during high risk activities like eating snack, or if we had to eat lunch, that it was really good to open a window or crack a window to improve the air quality in the classroom during that time. Some other things we did is we also purchased tents for outside. So we tried to transition a lot of our learning outside as much as possible. So we did outdoor classrooms, outdoor lunches. We did a lot of walks and learning and educational programs that way to really try to decrease as much as we can, exposure in the classrooms. So fortunately in Massachusetts, DESE in August 21 actually implemented the mask mandate. So the Department of Secondary and Education finally decided to support the local. Before then, it was a local decision whether or not to implement a mask mandate. And in August of 2021, this past August, they basically came out and said, you know what, we're going to have this mask mandate, which was really great because it supported us at the local decision level. because at that time, the numbers were low in our town, and people were very in that mindset of like, we don't need masks, this pandemic's over. And that wasn't true, right? We knew that during the summertime, you're mostly outside, right? And now everybody's going to come back to school. And what are we going to do? So we really had to kind of shift gears. And we're really fortunate that the state kind of stepped up and said, hey, this is a priority and we're going to follow through with it. We also did a lot of promotion and education about vaccines. So we actually teamed up with a third-party vaccination clinic very quickly in the school year. And we were able to really lock in some vaccine dates with the anticipation that the FDA was going to approve the vaccines for our students from 5 to 11. So we're really proactive with educating our families and also setting up those appointments and having them pre-register for appointments for the vaccine. And we timed it perfectly where 1 week, I think it was actually 5 days before, everything was approved. So all of our students that were signed up already were able to get their vaccine within that first week of like the release of the vaccine doses, which was extremely helpful. And over from November to at least, November to January, we were able to hold 7 clinics and we had at least 200 visits booked, but we were able to do walk-ins. So the nights were really long, I can tell you that much. But we actually had the clinics in our schools, which is really beneficial for our students and families because we have a MECO program in our school. So we do have inner city students who come to our schools and they were able to get vaccinated before they got back on that bus to go home. And I do think that our numbers in Swampscott, our vaccination rates are so high because we were able to lock in these vaccine clinics and really make them very accessible to everybody. Our faculty, our students, their family members could also sign up and come to the clinic, which was great. Another big thing that we really focused on is COVID symptoms monitoring, tracking, and data. So this is something that we felt really strongly about from the get-go, was really creating a systematic approach to tracking COVID cases in our district. So what we developed here in our district was a disclosure form and a COVID log. And what we did is every single case that was reported to one of our nurses, we actually entered it into a log, and we were able to make that log have multiple layers of questions. So we were able to really triage it to see like where was their exposure, what symptoms they were reporting. Was this an in-school exposure? Was it a sport exposure? And from that, we were actually really able to make mitigations, either increasing them or decreasing them, depending on the trends that we were seeing. Although that wasn't really common for a lot of the schools, it was a really hard sell for our nurses, but it also gave us that support in explaining to our families why it was necessary to maybe increase our mitigations before the Omicron or when the Delta surge came out. We were really able to say, hey, in the past week, we've seen an increase of cases, and this is what we need to do. So some of those additional mitigation tools that we applied was adding desk shields to classrooms. Although there was a lot of research that it's not going to help, it does help in a little bit because we actually had to have students eat lunches in their classrooms. So our lunchrooms, because we're an older district, a lot of our lunchrooms were small, and we really wanted to emphasize the importance of social distancing. So most of our elementary levels actually ended up eating their lunches in the classrooms. And what we did during the peak of the surge was really broke down and thought about what's the best way to handle these lunches? So we already are social distancing them, but what else can we do to help? So we did every other chair would do picnic time on the rug and really use some desk shields to really help, as an additional layer during that time and keep our little ones safe, and also our employees who now our teachers also had to take care of the kids during the lunch block, and they had their own concerns, right? We were very fortunate in the fact that we were able to make these decisions based off of the data that we were pulling. Another thing that we were able to do is while tracking some of this data coming in, we started to notice that there was an increase in exposures that were related to sports that were actually resulting in positive cases. So what we did is Massachusetts came out really early in August and said, hey, we're going to implement testing in the schools. This was a robust testing program that the Department of Elementary and Secondary Education and the executive offices of Health and Human Services and our Department of Public Health really collaboratively came up together and said, this is what we think is best. And they gave us schools the option to opt into it. And a lot of schools at first were kind of hesitant because it's a lot of work to get a testing program up and running in our schools, be able to explain to our students and families what it's about. And there was a lot of fear that this was going to take away more time on loss and learning and create more of a getting in the way. But we were able to quickly fill out our CLIA waiver. We really jumped on the bandwagon and was like, we're doing this because our end goal was to keep our kids in the school. And whichever preventative measures we could, we were going after. So when DESE came out with this testing program, there was 3 original options. One was pool testing, one was symptomatic testing, and one was a test and stay program. And I'm not sure if you guys are familiar with any of these testing programs, so I'll kind of break them down. Pool testing is taking 10 samples, dropping it into one pool, and just testing that one pool for COVID. If that pool was to come back positive, then each remaining 10 individuals in that pool would get then retested. And it was a really great system for surveillance testing, right? So we quickly got that up and running. We also offer rapid antigen testing in our school for symptomatic students. And then the big thing, which was new this year, was our test and stay. So off of the data, the Department of Public Health and DESE really sat down and was like, what can we do to keep the kids in school? And they came up with the test and stay, which is basically, if you were identified as a close contact to a positive individual in our schools where we have all these mitigations built up and in play, then we feel like we can keep you safe, and we're going to test you for the next 5 days of what would have been your quarantine timeframe. And believe it or not, it worked out really well. I mean, we had a large number of students at first who were being identified as close contacts and then following up with testing. But one of the major benefits of this testing was that, one, our kids could stay into school. And the second was that we would be catching cases a lot quicker and really decreasing that spread immediately. We would test all the students who were close contacts first thing in the morning. And as soon as they were positive, they didn't even get to go to the classroom. They would go right home to their families. So we found it very beneficial because it did really isolate the cases really quickly and decrease the spread in our schools. However, just recently, our testing programs have changed once again. And now as an additional preventative measure, we're doing at-home antigen testing. So the Department of Public Health is also funding that with DESE. And what happens is we're sending home these rapid antigen testing. And we're really telling our students that we want you to take them on this specific day, which is a few days after their pool testing, and report those results to us. We really felt strongly that reporting it back to us is a lot of districts who are doing this now did not want to follow through with that reporting system. But for us, we felt like it was really important, for one, to engage the families in taking these tests weekly. And the second is because, as we know, like the numbers that we're reporting to Maven, which is the state database, they don't account for any of the home testing. So at a certain point, we will be notified, the district, of these tests, these positive individuals, before the state might even know about it. And we really didn't want to lose that component of a screening mechanism for our district. So we really sent out there a lot of communication saying, here's your test, take it this day, but make sure you report it to us. This was the first week and we did so far so well. I'm hopeful it will continue, but really just monitoring those testing and having the availability to test our students has kept the majority of students in our schools. And they have kept our schools open and safe, which has been really beneficial. A couple other things that we really did, which also helped us, is that we really, when it comes to the reporting of the systems, having a systematic approach to it really helped triaging all the phone calls for our nurses. Because that was one of the hardest things, nurses would get emails, they'd get calls, and it was really chaotic at first on like all of this all of these people reporting to us, hey, I'm positive, what's the steps? Because although the state guidance was out there, our Department of Elementary and Secondary Education came out with their own version of it, right? And our district really collaborated really well with our local Board of Health and our local health department. And we really sat down and was like, what is the best for our children? And we decided that we were going to stick with the Department of Public Health's recommendation for quarantine and isolation. So during the height of the pandemic, a lot of our students could not reach their primary cares. And it was really difficult for them to know what to do. And here in our town, at least, our infrastructure, once Maven shut down for a while, or our CTC, our Collaborative Tracing Community, shut down, all of that work went to our local Board of Health. And they got inundated to the point, our health department, where they could not facilitate it anymore. So what happened is that all trickled over to the school system, right? And now we have on a daily basis, 23 students or plus looking for their isolation and quarantine guidelines. And we had to come up quickly with a system to handle that infrastructure. So what our district did is we really created a great disclosure form where families were, if you're sick or you're COVID positive, or if you became a close contact, you would go onto this form and you'd fill it out. And what would happen is all that information would trickle into a spreadsheet. We had one of our administrations or nursing look at it daily and send out that initial email of just your isolation guidelines, right? Because that was the big thing that people were looking for is, what do I do? So having that infrastructure of a great system really benefited us because our nurses were getting pulled in so many different directions, not just a COVID nurse, but also a school nurse, right? So you have medication you have to give and triage kids and things like that. But COVID was inundating our system in general. So we were really fortunate to create this quick system that helped decrease that clutter. And we also implemented that in for our staff as well. And it was very easy to track and monitor. And we could really project how many students were going to be out and shift those resources to which school we might need them and be able to kind of facilitate it that way. I think that the key for us in our district was really working with that mitigation, the multi-layers of it. So if one didn't work, we hopefully were able to catch it with another layer, right? By implementing the mask mandates, we brought in dividers, we had our robust testing facilities, we had our monitoring systems, our data and collection, our tracking. It was really beneficial to the point where, look at us today, we're doing okay. Now the surge is going down and our nurses are like, oh my God, what do I do? And it's like, oh, you have to go back to real school nursing, like transition, right? But I really can contest to the fact that having this multi-layered approach has been extremely beneficial and cut down on the number of students and staff who were getting infected and being sick and missing out on time on work and learning. So I'm open to questions. I know that was a lot quickly.